And you can see that some of the symptoms that I've mentioned that you see on the left there are present in both of these conditions. The most common symptom that people have if you have COVID-19 infection, when you look at the data, is fever. So you can see that's why I put that on top. Is this asthma or is this a COVID infection? If you have fever, in general, it's less likely to be asthma. Now, you can have an asthma attack from the flu or another illness that may cause fever, but in general, you don't see fever with asthma exacerbations, and you very commonly see it in COVID-19 infections. And body aches, as you can see there, in general, COVID-19 is a flu-like illness like influenza and will cause typical flu-like symptoms of fever, chills, night sweats, body aches. But in general, you don't see body aches in patients who have an asthma exacerbation versus a COVID infection. Cough. You probably have heard that cough is very common in COVID. Many patients develop cough even before they develop shortness of breath. And it is also a very common symptom in asthma. So cough is not a good differentiator. But if you have asthma and you have a history of asthma, you know what your asthma feels like. You know what the cough is like, wet or dry. And you have an idea if it's an asthma exacerbation, although it's not totally clear. Cough can be present in both conditions. Shortness of breath can also be present in both conditions. There were some interesting reports that came out, many of y'all may have heard, and there was some data that came out of China also that says GI manifestations, only GI manifestations can be a symptom of COVID-19 without even having respiratory symptoms. So it's important to note that if you have GI symptoms and you have some fever and you have some cough, it's probably less likely to be an asthma exacerbation and more likely to be a COVID-19 or another infection. And then finally, we're in the oak season right now. We're in the middle of spring season. A lot of our asthmatics have worsened asthma symptoms during the spring due to the pollination. And today, especially in San Antonio, it was clear, it was a little bit windy, it was perfect temperature for that pollination to continue and occur and worsen. So you normally don't see allergy symptoms in a COVID-19 infection, but you relatively commonly see allergy symptoms in someone who is having an asthma exacerbation, especially if they're allergic. I did put in wheezing. It's a little controversial, but I can tell you that in general, the COVID-19 infection is more associated with shortness of breath. You don't often see that much wheezing. Of course, in the more severe patients, you can see that. So I think it's very important to point out the differentiating factors, especially to our asthmatics. And